The mission of Flaget Memorial Hospital is very simple. We want to improve the lives of the patients that we serve, which is our community. Our cancer center opened a little over a decade ago, back in 2010, and exponentially has grown since then. We've gone from seeing about 6 to 10 patients a day to close to 60 patients a day on a regular basis. We've worked really hard to ensure that folks in this community were aware of the services that we offer in hopes that they wouldn't have to travel to Lexington or Louisville for services, that they would choose to stay here and be close at home for their care. We realized very quickly that we were going to outgrow our space, and we were very fortunate that the Flaget Memorial Hospital Foundation helped us raise about $1.3 million over a 3-year period. And we were able to create a cancer center that really positions us for future growth. So we went from 7 to 12 infusion rooms and from 3 to 5 clinical exam rooms. We were able to add on a pharmacy right here on site so that patients that were here for chemo didn't have to wait for everything to be brought over from the main hospital, which has been a huge benefit and has helped with communication with our pharmacist. And I'm really excited about our resource room that we were able to develop with this funding. We also now have a social worker here full-time that can help with any psychosocial needs. When you think about mind, body, and spirit and taking care of the whole patient, that's a huge part of it. And she also serves as a liaison to any community resources that might be needed.
Before the Cancer Center opened, cancer care looked a little bit different in our community. Patients were sent here from their oncology office, whether that be in Louisville or Elizabethtown or a neighboring hospital, where they were sent here with their orders for their chemotherapy to our outpatient infusion center. Their providers weren't here on site. We did not have a nurse practitioner or anyone like that. The nurse came and took care of those patients. So if they came and had issues, we had to send them back to their primary care doctors or their oncology providers to get taken care of. Now, here in our cancer center, they see a doctor, a provider at the time of their treatment. We're able to handle issues that might arise at the time instead of having to refer them back to their doctors. Many rural areas do function in that capacity where they get their oncology care in an outpatient infusion center. We are very fortunate to have our own cancer center here in our community.
Why is it important to be able to receive cancer treatments closer to home? I put it as a simple analogy. If I told you today that you had cancer, and let's say that you live by yourself, and I told you that you're going to have to come in every day and receive therapy 5 days a week, and at least once a week come in and receive some form of chemotherapy, and you have family or friends that you talk to but not all the time, and you're worried that you may not be able to make a trip that's an hour away or be able to make that trip several days a week with a family member who works full-time, you may in and of yourself decide that, well, maybe I won't take care because I don't want to be a burden. And that is the biggest thing that proximity offers patients to receive their care. We allow them the ability to say, you know what, I think I can focus more on what my disease is and focus on treating that disease and not having to worry about how it's going to impact my family. Transportation and logistics is a major problem in cancer care. I think that's one of the biggest barriers that we still have.
Patient treatments, depending on what types of drugs they're getting, can be frequent and long. We have patients who get here when we get here in the morning and they don't leave until we're leaving, 8 to 10 hour days sometimes, depending on their treatment. And so that just, if you think about having to add on an hour drive there and an hour drive back, if you had to go to another facility, that's a long day. That's a lot of time. So it's really important to us that we're able to offer it here in the community. It's a convenient thing for family members. They can leave their family members here with us in the cancer center. If they need to go to work, they can go to work. They can come back and pick them up to take them home. Whereas at other facilities, you might not be able to do that because it's quite a drive.
We're super fortunate to have that affiliation with the Cleveland Clinic. We had our partners in Lexington have the affiliation for a couple of years, and we realized immediately what a huge benefit it was for those patients. It's not just about name recognition. It's more about, easy access to second opinions, very quick second opinions, and being able to have subspecialists and experts give input into treatment plans, clinical training and education for our staff. When you think about the Cleveland Clinic and the fact that U.S. News and World Report ranks them top 5 in the nation, for cancer care. We're just very fortunate that our patients here in a small community have access to those services through our Cancer Care Center here in Bardstown.
I get asked frequently, how has it affected your practice having the ability to reach out to the Cleveland Clinic? It's reassuring for the patient, and it allows us to have someone behind us in a rural setting to say that, yes, this is the right thing that you're doing, and we continue this or change to this. It's reassuring, and it makes our patients feel that much more in tune with what they're receiving, because they're always told by outside family members that live in different areas, go to the big center, go see someone else, make sure you're getting the right thing. Don't just stay where you are because it's convenient. We hear that constantly. It allows them to have peace of mind, and that's very important. Cancer care is creating a relationship of trust. We are truly neighbors treating neighbors here, and pretty proud of that.
When you live in a rural area, there has to be an additional focus on the interdisciplinary team and the resources that are provided, because there's fewer resources in the rural communities. So we're really proud that our team here, our clinical team, has the knowledge, has the expertise here locally, but also has those connections to folks, whether it's in Lexington or at the Cleveland Clinic. That teamwork and collaboration is even more critical in a rural community where someone does have limited resources or transportation may be a barrier. All those things are just critically important in taking care of the patient.